In ENT, let's see the nerve supply of pinna and external auditory canal, and it is remembered by the mnemonic LAG 7 and 10. L stands for lesser occipital nerve, A stands for auriculotemporal nerve, and G stands for greater auricular nerve. And lower half of the pinna is supplied by greater auricular nerve, and in the upper half anteriorly by the auriculotemporal nerve, and lesser portion by the lesser occipital nerve. And this is the region of concha and retroauricular groove, and this is supplied by the sensory root of the seventh nerve and auricular branch of the vagus nerve, that is called as Arnold's nerve. So the auricular branch of the vagus nerve is called as Arnold's nerve, and this Arnold's nerve continues to supply the floor and posterior wall of the external auditory canal, and this auriculotemporal nerve continues to supply the roof and anterior wall of the external auditory canal. And if there is loss of sensation in this region of concha, is called as Hitzelberger sign, and this Hitzelberger sign is seen in acoustic neuroma. And a quick note about cochlea of the inner ear. Normally the cochlea will take about 2.5 to 2 3/4 of turns around a central structure called as modulus, and this central structure modulus, there are two structures passing, that is cochlear nerve and cochlear artery. If there is congenital anomaly of less than 2.5 turns is known as Mondini's dysplasia. And cochlea has three compartments: scala vestibuli, scala media, and scala tympani. This scala vestibuli and scala tympani are communicating via this helicotrema. The communication is called as helicotrema, and this is the base of the cochlea containing oval window, promontory, and round window, and this apex contains helicotrema. So the base of the cochlea is responsible for recognizing high frequency sound, and apex of the cochlea is responsible for recognizing low frequency sound. If a patient have problem near the oval window, promontory, or round window, the patient will have high frequency hearing loss. And if a patient has problem near this helicotrema, near the apex, the patient will have low frequency hearing loss.